Welcome to episode of Dr. D's Table Talk. We have our distinguished guest today, Dr. Huma Khan, who is an adolescent medicine expert at Advocate Children's Hospital in Oakland and Park Ridge. She finished her medical school at University School of Medicine in Illinois in Peoria, and subsequently she did her pediatric residency at University of Michigan in Ann Arbor. She was in private practice for 4 years, and subsequently she finished her fellowship in adolescent medicine at University of Illinois in Chicago, along with the Master of Public Health. And she is currently attending adolescent medicine expert at Advocate Children's Hospital, and her current interests are mental health and eating disorder in adolescent patients. Welcome to the program, Dr. Khan.
Hi, thank you for having me.
Let's jump into the topic right away. So we have heard about HPV virus and HPV vaccine. What does HPV stand for? What kind of different diseases this virus is capable of causing?
Okay, yeah, so HPV, what does that stand for? It stands for human papillomavirus. So HPV is a group of more than 100 viruses that commonly infect humans. And certain types of HPV can cause visible and sometimes troublesome genital warts. Some HPV virus types can cause cancer later in life, and nearly everyone will get HPV at some point in their lives. More than 42 million Americans are currently infected with HPV types that cause disease, and about 14 million Americans, including teens, become infected each year.
Sure. I've heard that there is a carrier state of HPV virus. What does a carrier state means, and how does it affect people?
So a carrier state would be if you actually had the HPV infection, yet you weren't showing any physical signs or having symptoms.
Sure.
So in that case, it's possible to transmit HPV to another person without even knowing it.
Sure. What are the common ways and means by which an HPV virus can spread from human to human?
So HPV is spread through intimate skin-to-skin contact. One can get HPV by having vaginal, anal, or oral sex with someone who has the virus, even if they don't have signs or symptoms.
Sure. What are the different disease spectrums it's capable of causing in human beings?
So most HPV infections go away by themselves within 2 years, but sometimes HPV infections can last longer and can cause some cancers. So HPV infections can cause anogenital cancers, including cervical cancer. It can also cause cancer of the back of the throat or oropharyngeal cancer, including at the base of the tongue and tonsils in both men and women.
Right. What is the epidemiological and economic burden of this particular virus? How common it is, how prevalent it is in the general population, and how does it affect economies in terms of how much does it cost, the disease burden generated by this particular virus?
Sure. So human papillomavirus is the most common sexually transmitted infection in the United States. Every year in the US, about 36,000 women and men are estimated to be diagnosed with a cancer caused by HPV infection. And about 50% of new HPV infections occur in 15 to 24-year-olds.
Right.
As far as the economic burden, what we know is that HPV attributable cancer deaths are associated with a substantial economic burden in the US, and much of this can be vaccine preventable.
Sure.
So one study looking at the present value of future lost productivity showed that the PVFLP, or present value of future lost productivity, is approximately 3.8 billion for cancer deaths attributable to the 9-valent HPV targeted types.
Sure.
And the highest economic productivity burden was associated with cervical cancer in women and anal and oropharyngeal cancers in men.
Sure. And obviously this economic burden does not count the mental anguish and the stress that the families and the patients go through, which is also very substantial and sometimes cannot be calculated in economic terms.
Yeah.
How do we prevent this common virus from getting into people?
So we can prevent this by vaccination. So the 9-valent HPV vaccine targets many types of HPV 9 specific types, and the types are 31, 33, 45, 52, and 58, in addition to a 4-valent HPV targeted types, which are 6, 11, 16, and 18. This virus vaccine has been around since 2005, and the 9-valent vaccine was licensed in late 2014, and since late 2016 has been the only HPV vaccine sold in the US.
Sure. What age groups is it usually given at, and how many dosages are generally needed?
So the vaccine is recommended for 9 to 26-year-olds, and it was recently extended up to 45 years of age. So there's a 2-dose schedule that's recommended for people who get their first dose before their 15th birthday. And in a 2-dose series, the second dose is given 6 to 12 months after the first dose.
Sure.
And a 3-dose series is recommended for people who got their first dose on or after their 15th birthday, and for people who are immunocompromised. So the second dose is given 1 to 2 months after the first dose, and the third dose is given 6 months after the first dose.
Sure.
And this dosing schedule is based on the best available scientific evidence of antibody response.
So you would generally recommend giving this to children as early as 11, 12, or 13 years of age.
Mm-hmm. Yes.
And then we know that for the 6th grade physical exam for 11-year-old children, we tend to do meningitis as well as tetanus vaccines at that time.
Right.
And is it okay to add another 3rd vaccine to this particular series? And how would you comment on that? The parental concerns about getting 3 vaccines at the same time. Is it advisable?
Yes, definitely. I would definitely recommend giving all 3 at once. Just because we know that this is a safe and effective vaccine to be given alone or with the other recommended vaccines for that age group.
Sure. What are the common side effects that you have seen in your practice? We know that vaccines can cause mild side effects, and obviously the side effects, are generally milder and common. I wonder what, in your experience, you have seen that to be a common side effect of HPV vaccine.
Right. So like any vaccine or any medication, the vaccine can cause mild reactions. So pain or redness in the arm where the shot is given. Other typical side effects include low-grade fever, headache, feeling tired, nausea, muscle or joint pain, or dizziness, all of which are temporary, and rarely an allergic reaction can occur.
Sure. And we also know that sometimes it can cause dizziness. So we usually tend to observe these patients in the office for about 15 to 20 minutes to make sure they don't get dizzy, either because of anxiety or pain associated with that particular vaccine.
Right.
So what's your message to concerned parents about so many myths and so many false information being spread out about this particular vaccine? How would you calm a concerned parent or an anxious mom or an anxious father when they are trying to get their child vaccinated at age 10 or 11 or 12, or even before that? And what is your message to the parents in terms of so many controversies about this particular vaccine that are circulating?
Right. I would let an anxious parent know that they are not alone in feeling worried about this. Anytime we're thinking of giving a medication or a vaccine to our child, we want to know all of the information and understand that we are not putting our child at risk of any harm. So what we do know is that there is a perceived lack of safety and different ideas that are being circulated, a perceived lack of necessity, and lack of accurate information about the vaccine that is out there. And there is also a concern that giving the HPV vaccine will increase the likelihood that a teen will become sexually active. So what I would explain to parents is that the vaccine itself has been researched for many years, including at least 10 years of research before it could even be used in humans. And it is highly monitored by the Food and Drug Administration.
Sure.
And studies have also told us that getting the HPV vaccine doesn't make kids more likely to start having sex.
Right. I think that is a very important message that parents want to hear, because that is a concern that we all hear from parents as pediatricians when we are doing office practice and advising this particular vaccine. So that's very important. As you might be aware, recently, a couple of days ago, there was an extensive study published in Lancet from UK about effectivity of HPV vaccine. If you could comment on the discussion that they had, what kind of study did they do, and what were the results of the study, would appreciate it. Because when I read that study, I was very impressed with the number of patients and the discussion that they had. So I would appreciate some comments on that particular study, which was published about a couple of days ago.
Right. So this study was assessing the HPV immunization program in England. And what it found was that the estimated relative reduction in cervical cancer rates by age at vaccine offered was 34% in the age group of 16 to 18, 62% in the age group of 14 to 16, and 87% in the age group of 12 to 13 years. This was compared with a reference of an unvaccinated cohort. So this study showed a substantial reduction in cervical cancer and incidence of grade 3 cervical intraepithelial neoplasia in young women after the introduction of this HPV immunization program in England, and especially in individuals who were offered the vaccine at age 12 to 13 years.
Right. So again, confirming the fact that the earlier vaccine is given to a patient or a child, better the protectivity is in the
Exactly.
effect. Sure.
Yep.
Thank you for your time. Any concluding remark for some of our patients who may be listening to you, and a take-home message to our parents and adolescent boys and girls who have heard so much about this particular vaccine in various media and other sources? What would be the take-home message for parents and children alike from your experience?
Right. So I think my take-home points that I would want my patients and parents to understand is that, again, nearly everyone will get HPV at some point in their lives. It is the most common sexually transmitted infection in the US, and that these infections, again, can lead to anogenital and oropharyngeal cancers later in life. The HPV vaccine can prevent more than 90% of cancers caused by HPV. So I definitely recommend choosing to vaccinate your child against HPV in order to prevent them from developing cancers later in life. The HPV vaccine provides safe, effective, and lasting protection against the HPV infections that most commonly cause cancer.
Thank you. Thank you, Dr. Huma. It was good to hear about HPV vaccine and the comments from an adolescent expert like you. And I'm sure our parents will take this message very seriously and make sure that their children get vaccinated against HPV along with other vaccines, including the COVID vaccine and the flu vaccine before age 12. Thank you for your time. I really appreciate it.
Thank you. Thank you for
having me.
You're welcome.